Next, we have the stakeholders. In this section, we're going to talk about what's required for the project to be completed, what the project needs, the attitudes with or from the stakeholders, and then the actions that need to be seen. So the three stakeholders that we have is hospital administration, physicians and pharmacists, and then also the nursing leadership or care team, nursing care team as well. I combine them both because we still have the separation from the hospital administration. So with the hospital administration, what's required for the project is sponsorship. We need sponsorship from the hospital administration team and from others. The project needs funding. The attitude we need from the head of the house is the motivation and encouragement to go through with the process that was created. So, for example, with the new technology, we need encouragement and motivation so that the team beneath them, which would be the physicians, the pharmacists, and the nursing leadership and care team, as you can see, it's a pyramid, so it starts from the top. We need that motivation and encouragement so that we can actually implement this project as an action to move forward with. From the physicians and pharmacists, we need input. We need input from them so that we can get all the data that we need. We need to make sure that the medications that they prescribe and use is in the system, it's in the machine, so that they can do the cross reference to make sure there's no drug interactions. Compliance from the physicians and pharmacists, so that we know that the system is working efficiently since they will be the ones using it as well as the nursing team. And then one of the things that you might see is a risk or an attitude from the physicians and pharmacists would be resistance. It's a new project, it's a new plan, it's a new objective. You might find a little bit of pushback from them. The last one is the nursing team, nursing leadership as well. I combined them both. So, one thing that's required for this project is education and training. They need training for this project to be successful. What the project needs from them, compliance as well. Willingness to learn, willingness to be a part of it, willingness to give input so that the system can work efficiently. One of the things that you run the risk of, or that you might come across as far as the attitudes concerned within this position, is interest and fear. They might be interested in doing this. It might help them um, as a second point of reference when they go to check the medications, when they go to administer. Then they might also have a little bit of fear or self doubt. Or lack of confidence when using this because it would be a new tool. It would be something new to add to the plate. And then one thing that we want to see as an action as a result of this is the standardization of care, creating this and making this a standard of care so that we can hopefully create a better and more safer environment for our patients.